Regarding this Medisave and the funds and all these things, but I'm 58 this year. I still have about 50,000 in my Medisave. Okay, which thank goodness I don't have any major surgery or operation. So I'm sure there must be a lot of people who have between 30 to 40, 50,000 in their Medisave, and that money is untouched. So my proposal is that why don't the SDP come up with a proposal that out of this 50,000 that I still have, 30,000 goes into an insurance scheme. The balance 30,000 to be set aside. But for those who don't have that 30,000, say for the seniors, their children can contribute, top up. And that 30,000 insurance for a period of time, maybe 25 years. At any time, the policyholder kick the bucket. 30,000 insurance policy that is valued at the end of the policy life, 70,000. That 70,000 goes to the next of kin or the son, whoever top up the money. It's a win-win situation. So we don't keep the money in the CPF for nothing, just earning the peanut interest. You get what I mean?
I actually thought about this, and this is one of the things that we considered. But one of the principles is we do not want to burden the next generation. See, the idea is you should not, if you're a young person, you're starting a family, you're worried about your kids, the last thing you want to do is you have to worry about paying the premiums for your parents. You see, your parents have worked really hard. Our parents built up Singapore from a very low baseline into a prosperous, well-regarded city. See, I think that they have earned some kind of recognition for, and it shouldn't be just given out in some fancy package every 5 years. See, it should be a recognition that they have been entitled to the security, not just the security of walking down the street, but also the security that they can get sick without worrying about the cost of that. So it's an interesting idea. We thought about it, this idea of the single premium kind of insurance sort of approach. But we think that we should rather give the money back to the individual. So, all the $88 billion potentially could be given back to the individual. We have always argued, and again, you're going to hear more about this at the next policy launch, that your CPF is your money. The government promised to give it back to you at 55. They should give it back to you at 55. If you want to leave it inside to get the 2.5 or 4% interest, that's up to you. But it should be your choice. See, again, we are adults. You see, we're old enough to think for ourselves. See, we make mistakes, sure. But if we have access to good information, in Singapore, people want to make a decision. You go down to the coffee shop, you talk to your friend, right? You call somebody up, you ask somebody who's 2 or 3 years their senior, what have they done? I'm going to turn 55 next year. The first thing I'm going to do is ask my friends, what do they do with the money that they took out of their CPF? You see, we're still talking about that. So we are an intelligent and adult population. We should be able to decide for ourselves. What you have suggested is an interesting idea. Like I said, we've talked about it. At the moment, we think it may be a consideration, but there are a couple of things that we are concerned about. One, primarily, is we do not want the next generation to be paying for this generation. Each generation should pay for itself.